Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
COVID-19 has introduced a lot of new terms into our vocabulary. For instance, variant, like the Delta variant that's flying all over the place right now. PPE stands for personal protective equipment, like those N95 protective face masks that you see doctors and nurses wearing. And unfortunately, what's becoming a little more well known is ground glass opacities. It's a type of lung damage that's showing up on CT scans in patients with COVID-19 pneumonia. So a lady came into my store, incredibly interesting person. Several months before, she had been hiking in the Himalayan mountains. She had been climbing mountains in Tibet and Nepal and Bhutan. A month after her climbing, she was back in New York and she contracted COVID-19 and she had a pretty bad infection for 6 weeks. And it wound up damaging her lungs. And because it was harder for her to breathe, it put a lot of pressure on her heart, and her heart grew, her heart expanded, and her heart's a little damaged. And it also led to severe GERD, gastroesophageal reflux disease, where your stomach contents are refluxing up into your throat. Not a pleasant thing. So I told her, listen, I can't fix your lungs, but I can give you a couple of supplements that are good for the lungs and may help you breathe a little bit easier. And they're protective for the lungs. I can't fix your heart, but I could give you a supplement that makes the heart a little stronger. And, the GERD, let's discuss that. I said, but I want you to see my friend who's a rheumatologist. He's a great rheumatologist. I don't think he'll mind if I say his name right now. His name is Dr. Stephen Bernstein. He's in Manhattan. I said, because I want you to get your cytokines checked. Because certain cytokines are connected with long-haul COVID-19 and persistent damage and persistent inflammation. So let's see if some of those are elevated. I'll give you for instance, interleukin-4. Interleukin-4 is involved with lung inflammation and lung damage and asthma. It's also involved with inflammation in the skin, but it can also be involved with inflammation in the brain. Interleukin-4 stimulates monocytes. And they find in COVID long haulers, monocytes are activated. It's a type of white blood cell, and it's damaging tissues, and it's creating turmoil, and so all kinds of symptoms like depression and headaches, etc. I said, so if we can find that there's certain interleukins that are elevated, we can help push back on that. We can help try to lower those. I'm not saying it's going to fix your lungs, but if we decrease your inflammation, it's going to be a lot easier for you to function. And it might even get a little bit easier for you to breathe. You'll certainly have more energy, and it'll certainly help protect you. So the topic of today's episode, COVID-19 wrecked the lungs of this mountain climber. This is a true story. My name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the senior scientific officer over here at Invite Health. I'd like to talk to you about what happens with COVID-19 in the lungs, and perhaps certain nutrients that can help protect you. And we'll go over some of the research involved with that. It's not a great deal of research, but the results were very good. I mean, it really confirmed my feeling that certain nutrients will help protect people with COVID-19. Please subscribe to the Invite Health podcast, and please leave us a review. You can find all of us on Facebook, Twitter, and Instagram at Invite Health, so you can follow us there. All of the information on today's episode will be linked in the episode description, and you can visit invitehealth.com/podcast for more info. I want to get started. So ground glass opacities, usually when you take a CAT scan, I better tell you what a CAT scan is. A CAT scan is a series of x-rays of the same tissues from different angles, and you put it all together, and it gives you a 3D view of that organ. So it could be the lungs, it could be the kidneys, it could be the pancreas, any soft tissue. X-rays easily go through soft tissue, but they can't go through bone, so you could see these different organs. And in a typical CT scan, a lung X-ray will show up as dark. But in ground glass opacities, you'll see kind of like, it'll look like smashed up glass. You'll still see the tissues of the lungs through it. It's kind of like a mist. And they're finding this very commonly in people who've had COVID-19 on CT scans. So it's related to the SARS-CoV-2. Let's get that terminology down. The current pandemic is by a coronavirus, which can be thousands of viruses. There's about 5 of them that cause the common cold in the United States. And there's been other coronaviruses that have been very dangerous, like MERS and SARS. So this is called SARS-CoV-2. That's the name of the virus. And the infection itself is called COVID-19 because it started out in 2019. So finding these ground glass opacities, it's a more common finding on the CT scans of patients with doctor-confirmed SARS-CoV-2 pneumonia. There was a couple of studies showing this. For instance, there was a study in China published in the journal Radiology. It was 51 Chinese patients with COVID-19 pneumonia. And when they gave them CT scans of the lungs, 77% of them had ground glass opacities. Now, you can also find fluid in the lungs, in the lining of the lung tissue. And some people develop thickening of the tissues in the lung when they have these viral pneumonias. But not all patients do. So I didn't say I could help this woman's correct her lungs or anything, but I think you can help her. Now, we're not talking about vaccines here. That's a whole nother episode. But studies do show that certain nutrients lower your risk of developing COVID-19. That would be vitamin D, fish oils, multivitamins, probiotics, zinc. It gives you some degree of protection. But that's good because that could also mean that if you develop COVID-19, it may never get really dangerous. But there does seem to be nutrients that help treat COVID-19 and help prevent you from getting into real trouble with COVID-19. So I want to go over that very quickly. Like I said, the research is limited, but they're getting very good results. So that's a very positive thing to me. Now, the first one was glutathione. Glutathione is a master antioxidant that protects your eyes and your brain and your lungs and your heart and your liver. It's also involved with detoxifying chemicals. It's a natural thing that we make. It's an enzyme system antioxidant. It's very powerful. But the amount of glutathione can vary dramatically from person to person. There was a report from Brooklyn and Downstate Medical Center. A woman very early on got COVID-19, and she had such a problem breathing that she couldn't even stand up. If she stood up, she got dizzy. She would fall over and hurt herself. Now, her son is in medical school in New York. He had worked for a time in a clinic upstate New York, and a doctor that treats patients with long-haul Lyme's disease. This does happen. Sometimes the regular drugs don't knock out Lyme's disease. And these people can get very inflamed. It can even cause damage to their heart. He's giving them glutathione. So the young man in medical school contacted this doctor, a well-known doctor, and asked him, what should I do for my mother? And the doctor said, give your mother glutathione. It helps my Lyme disease patients. And glutathione levels drop dramatically when you get a viral infection or any infection. So the kid I think he was in his early 20s, he started giving his mother 2,000 milligrams of glutathione, and she said within an hour she was up making her bed and she went to shower. They gave her glutathione for the next 6 or 7 days and she never got really sick again. There was a second report by the same medical student, an elderly man in a hospital in Brooklyn who couldn't breathe. He gave him glutathione by infusion, and very quickly he was out of bed. Within a half an hour, he felt better. So that's limited evidence, but there's nothing wrong with taking glutathione. But the reason they give 2,000 milligrams, glutathione is a tripeptide. It's made out of 3 amino acids. It's a rather large molecule. It's not well absorbed by humans. So to get enough to the lungs and the brain and the arteries, etc., you need to take enough, and that would be 2,000 milligrams. But you know what? It's no sin to take 3,000 or 4,000 milligrams a day either. Then there's black cumin seed. Black cumin seed is called Nigella sativa. It's mentioned literally in the old religious texts, the old Jewish religious texts, the old Christian religious texts, and even the Quran, helping people with different illnesses. It grows in the Middle East. They use black cumin seed in those flatbreads in places like Turkey and Lebanon, etc., to keep it fresh. But it also tastes really good. So this doctor is a research fellow at Harvard Medical School in Boston and Massachusetts General Hospital. His name is Dr. S. Ashraf. He's the principal investigator. And what happened, in Pakistan, COVID-19 was destroying people. It was literally destroying people. So he went over there and he gave them a combination of the black cumin seed and honey. It was 313 patients. Let me give you a little background on these patients. 210 of these patients were categorized as moderate cases with COVID-19. They had a cough, they had fever, sore throat, nasal congestion, but tellingly and scarily, shortness of breath. 103 patients had severe cases. They had a fever, they had a cough, they had pneumonia, and they had respiratory distress. It was hard for them to breathe. It was in Lahore, 4 different medical care facilities in Lahore, Pakistan. So he gave them the black cumin seed along with honey, or not, or they gave him a probiotic every day for a limited amount of time. And they found that the people on the black seed, the black cumin seed with the honey, they got better a lot quicker than the people on not getting the black seed with the honey. They were better within 6 days compared to the other people that took 13 days. But they also got a negative PCR test. You know, that's used to diagnose COVID-19. That's where they stick that kind of Q-tip thing up your nose. 4 days earlier in general than the people without the black seed with honey combination. So it really did mean something. Now, so that's black cumin seed. It's also called black seed. Giving them that with honey, because there are things that are really healthy in honey. Unfortunately, there's a lot of sugar in honey, but there are things that are healing in honey too. Now, a third thing was a type of turmeric. Turmeric is that ingredient that gives curry its characteristic odor and flavor and color. And turmeric has like 150 different ingredients in it. And there's a lot of them that are really important, like aromatic turmerone and bismuth oxycurcumin. But the most well-known ingredient is called curcumin. So there's a type of curcumin complex, it's got the whole plant in it, where they mix it with a black pepper fruit extract. And this makes it really well absorbed because curcumin and turmeric are very poorly absorbed by humans. So there was a study in the journal Frontiers in Pharmacology. That's a pharmacy journal. And they used this very well-absorbed curcumin in 140 patients with COVID-19. It was a 14-week trial. Now, the 140 patients were categorized as having mild COVID-19, where their oxygen in their blood remained above 94%. So let's talk about that. You could get a little contraption called an oximeter that you clip on the end of your fingers. It works on a battery. And it tells you your oxygen saturation and your pulse rate within seconds. So you're supposed to have like 98% oxygen saturation. So in COVID-19, if it goes below 90, that's really scary because, at a certain point, there's not enough oxygen and it starts to hurt your organs, your brain, your heart, etc. And that's one of the dangers of COVID-19. So I tell my listening audience on the radio and my clients, get an oximeter, not expensive, keep it around. Whenever you get an infection, clip it on the end of your finger every day and check your blood oxygen. Because your medical doctor will take you very seriously if you tell them, I used an oximeter and my blood oxygen is below 94. They'll say, well, come on in. But if you just tell them you're not feeling well, they'll say, well, let's see what happens. Okay, so get an oximeter. It'll help keep you safer. So it's 140 patients. Some of them were mild, where their blood oxygen remained above 94, which is fine. Some of them were moderate, where their blood oxygen saturation was between 90 and 94, and a regular room air. But they had pneumonitis. Pneumonitis is inflammation in the tissues of the lungs, so they had some inflammation. And then some were categorized as severe, where their blood oxygen was below 90. Now, the patients with mild to moderate COVID-19 were admitted to hospital wards, but the patients with severe symptoms were put in the intensive care unit. So they gave them the curcumin with the black pepper fruit extract, and it really meant something. Versus placebo. And once again, they used a probiotic as placebo. It prevented their blood oxygen from going below 94. It helped keep their oxygen saturation in their blood above 94, which is very good. But they had a much earlier recovery of the symptoms, like a fever, a sore throat, a cough, but tellingly, breathlessness. So there are things you could do for prevention. Vaccine, we're not going to comment on that right now. I've had it. I had the Pfizer one. My wife had it. My kids had it. Their wives had it. My mother, who's 91, had it. We did get some arm pain at the site of injection. We did get some fatigue, or every one of us, but nothing beyond that from the immunization. But the thing is that that doesn't mean I'm not getting my zinc, my vitamin D, my vitamin C. That doesn't mean I'm not taking my probiotics and my fish oils. All these things have been shown to lower the risk of infections. So vitamin D, fish oils, a multivitamin, probiotics, depending on the strains, of course. You want strains like Bifidobacterium animalis, subspecies lactis, and Lactobacillus plantarum, and Lactobacillus rhamnosus. They're more active strains. They're more active species. They give you some degree of protection. But if I did get sick, I would definitely take some curcumin because it's going to help protect my brain and my lungs. But if I did get sick, I would definitely take some curcumin because it's going to help protect my brain and my lungs. I would definitely take some ubiquinol to help protect my heart. I would definitely take resveratrol, which is great for lung health. I would probably also take beta-1,4-glucan that stimulates the immune system to fight viruses. Nothing wrong with that. I would take some nucleotides. They give quick energy to the immune system, and this allows the immune cells to multiply very quickly to meet the onslaught of the virus that's trying to infect you. So that's what I would do. And yes, I'm keeping these at home in my medicine cabinet. So thank you for tuning into the Invite Health Podcast. You can find all of our episodes for free wherever you listen to podcasts, or just visit invitehealth.com/podcast. Please subscribe and leave us a review. You can also follow us on Twitter, Instagram, and Facebook at Invite Health. I hope to see you next time on another episode of the Invite Health Podcast. Thank you so much for listening. Jerry Hickey signing off.